Two.
Good evening and welcome into another edition of One-on-One with Hubert Smith here on your community television. Just to remind you, we are broadcasting on Comcast Channel 12, Nology and Charter Channel 6, AT&T Uverse Channel 99, and we are streaming around the globe on ctvknox.org. That's ctvknox.org. Now, why is that important, you might ask, if you're watching on cable? Well, the topic that we're going to be covering tonight and for the next few Fridays, and I'll tell you a little bit more about that in just a few moments, the topic that we're covering tonight, as you can see in the background, will be about the Affordable Care Act. And the site that you see behind us on your screen is healthcare.gov. Now, not so much about that necessarily, except that that's what's being shown around the country, so I thought that may be a shot that you might be familiar with. But primarily tonight, we're going to be talking about the Affordable Care Act. And here with me to talk about that, I have Mary Hedrick, a medical doctor, board certified in internal medicine, who has practiced in clinics and emergency rooms in East Tennessee for over 30 years. So Dr. Hedrick, welcome.
Thank you.
Glad to have you here. Just to give a little bit of background on Dr. Hedrick as far as how I know her and how I came to invite her on the program. As you know, in attending community meetings throughout Knox County as I do, I was at a meeting one time up in the Gibbs community, and Dr. Hedrick was the featured speaker, and she was there, and this was some months ago, to talk about the Affordable Care Act. And I was not necessarily so impressed, although that I was, but the key thing is that she locally is the most informed person that I have come across who can talk about the Affordable Care Act and make sense of it, which is the main thing that we're going to do. So, here's your little preview. Tonight, we're going to start from the very basic level of what is the Affordable Care Act, what it isn't, what it is not rather, and dispel some of the rumors about it, and also take you through a very basic elementary course on what it is. Then I'm going to do that on the following Friday, a week from now, and we're going to do it again on the following Friday, 2 weeks from now. So I'm going to devote the next 3 programs of my regular Friday night show toward the Affordable Care Act. Now, be clear, I am not coming from a position of advocacy, all right? But I feel that I have a responsibility with this program to bring this information before you, and then, as they say, you can decide. So that's how it's going to be tonight. And by the time we do the third show, I'm hopeful that we will have given you enough information, as long as what you have gathered with other outlets or news media, whatever the case might be, then you can call in and ask Dr. Hedrick some questions. So let's just get started now with the Affordable Care Act. In March 2010, President Obama signed Comprehensive Health Reform, the Patient Protection and Affordable Care Act, or ACA, into law. And the law makes preventive care, including family planning and related services, more accessible and affordable for many Americans. While some provisions of the law have already taken effect, many more provisions will be implemented in the coming years. And so let's talk about what's taking effect now. We know that as of 10 days ago, or 11, whenever you started counting on October the 1st, the website came online. What you see behind me, that's one way to get to it. And then people started signing up. Is that right, Dr. Hedrick?
That's right, but you've left out a whole lot about what has already come on board.
Well, that's why you're here.
Tell me some of the things you think have already happened with the Affordable Care Act.
Gosh, I'm not really sure.
How about those folks on their parents' plan until age
26?
Yep, you got it. How about folks on Medicare can now get a well exam with no copay once a year? Did you know that?
Didn't know that.
Yep. How about that donut hole? What do you know about that Medicare donut hole for prescription drugs?
Other than it's a big space in the middle.
Okay. Folks in the middle who have to pay for medicines, they are going to see that donut hole close. It's getting smaller and smaller every year, and by 2020 it's going to be shut. So we won't have that gap for folks who are middle income in Medicare having to pay for prescription drugs. And then we've had a lot of changes for children from the get-go. Do you remember what some of those were?
I do not.
They took away the cap for children's care, for their medical care, And they took away the ability of an insurance company to exclude a child because of a pre-existing illness. So those things are already happening and have been in place for a while. And we not only have that opportunity to buy insurance through this thing called a marketplace, whose advertisement you see behind us, but we also have changes for just about all the insurance plans that come into effect for everyone, no matter where you get your insurance. Do you know what some of those are?
Some of the companies or some of the changes?
Some of the changes.
I do not.
Everybody.
Just mark me, I do not on all the questions, because I doubt if I know more than our listening audience.
I'm going to ring some familiar things for you, and you'll realize you knew the answer and just said you didn't. When we get around to January 1st, health plans are not going to be able to say no to you just because you have diabetes or multiple sclerosis or cancer, and they're not going to be able to charge you more because you have those diseases. And this rule is for all the new insurance plans or the qualified health plans that'll be on the market, whether they're through this marketplace or whether you buy them through your company or you buy them through some other arrangement with Farm Bureau or some other insurance agent. So there are going to be insurance reforms, and that is the protection part of this law. Do you know what the full name for our law is?
The Affordable Care Act.
It's got another part in front of that.
Healthcare.
PPACA, Patient Protection. And so one of the things that's going to happen January 1 is patient protection. I had a fellow with a heart murmur that I sent, and he was told he needed surgery. He was pre-certified by his private job-based insurance plan to get that surgery done. He got it done, and while he was laying in bed on a monitor recovering, the insurance representative came to him and said, "We've changed our mind. We've decided that this is a pre-existing illness and we're not going to pay for it." That's not going to happen anymore.
And this becomes effective in 2014.
Yes, for everyone, even if you have job-based insurance.
I did know that.
Yep.
Yeah, 2014.
Yep.
Okay, let me go back and ask you some things that you covered. Okay, so what happened on October the 1st that caused the big fanfare that did not occur prior to October the 1st of these things that you said are already into effect?
Before, if you wanted to buy an individual insurance plan, you would go out and you would talk to an insurance agent, or you would go by an office that sold a particular brand of insurance. Now we have a new place that you can shop for health insurance called the Marketplace. And this is an exchange or a shopping center that you can go to on the internet or by telephone and look at plans that are following some specific rules that have to do not only with the patient protection but also with making them more affordable. So the new thing October 1st that was that you could start looking at that marketplace and looking at the insurance plans and begin the enrollment process.
Question. So you mentioned from the outset that children now up to age 26 can stay on the parents' plan. So when did that go into effect?
Gosh, I don't know the exact date, but I think it was in 2011.
Okay.
But, certainly it's been there for a while.
And that didn't get a lot of publicity.
No, it didn't, and it really had a tremendous impact. If I'm remembering the number right, about 2 million additional folks got insurance because of that provision.
Okay. Okay. And so let me talk about some things that are going on now that people may be as confused about as I may possibly be. You talked about pre-existing conditions now. So when did that go into effect? That's already in effect.
No, that begins in January. Right now, if you went out and bought an insurance plan through an individual agent, you could be charged extra if you had diabetes, and that isn't going to happen. Come January 1, the plans can't look at your medical history and increase your prices because of that. Not only that, if you get sick while you're on that plan, they just can't frivolously knock you off because they don't want to pay extra expenses.
Okay. I'll try not to interrupt you because I know you have a lot of ground that you want to cover today on our initial program, so I'll just step out of your way and allow you to do that.
Oh, you know that's not going to happen. I'm going to keep asking you questions.
Okay.
So we've got this marketplace, but do you know about how many % of people that marketplace is going to open up for or help?
2-3 million?
It'll be more than that, but it turns out that about 83-84% of folks already have health insurance, and they'll keep that. They'll just get those extra protections we talked about. So we have about 17% of the population.
Which is about 300 million, the population.
Yep.
Yeah.
So if we home things down to just here in the Knoxville area, just Knox County and the surrounding 8 counties, we have about 1 in 7, about 14%, or about 112,000 people who do not have health insurance. So that's a large number of people who will now be able to look at that marketplace and hopefully find an affordable plan and not have to worry about losing their job or their COBRA running out or losing their insurance because they're not able to work as many hours. Those sorts of things shouldn't apply come January 1. Folks who don't have insurance for whatever reason or who find their current insurance dreadfully too expensive can look at that marketplace, with the exception of those who have Medicare. Those who are already on Medicare are taken care of. This marketplace is not for them. They're not going to have any opportunities or changes that they need to fret about.
This is maybe kind of off the mark a little bit, but I have to ask because that's what's going on today, at least as of now. So what if for some reason Congress decides they're not going to fund this? Is it all just gone?
If I can't imagine that they would be successful at changing this, but if they were, the effect would be to take away all the tax and revenue and savings compromises, so that if they took away, reversed, repealed the Patient Protection and Affordable Care Act, they would increase the national deficit, the national debt over 10 years by $105 billion. This has already been paid for through changes in the tax code and changes in how we spend our government health care dollars, and in these other changes that we've talked about, like penalties if you don't get insurance. So it would be pretty dreadful if they reversed what folks have fought for so long. And this bill is actually a compromise law. This is something that the Republican-based Heritage Foundation proposed, including a mandate, many years ago. And I know that because I've been working on health insurance reform for 30 years. And my choice would be a single payer, to have Medicare for all. So supporting this bill is a compromise for me and many others who think we could spread our health care dollar further and better. But this really comes out of a very conservative background and looks very much like Republican Bill Frist's proposal that he had when he was our senator.
And also Mitt Romney in Massachusetts.
You got it.
Yeah.
Yep.
If you're just tuning in, welcome into another edition of One-on-One with Hubert Smith here on your community television. And tonight is the first of series for the next few Friday nights that I'm going to be doing along with Dr. Hedrick about the Patient Protection Affordable Care Act. Did I get it right that time?
You did.
All right, I'm learning. See, you used to be a teacher. You taught me already. And what we're going to do is for the next 3 Friday nights, at the remainder of, do a sort of escalate this conversation. Today is some very primary, basic information, if you will, about the Patient Protection Affordable Care Act, and then we're going to, well, not we, Dr. Hedrick is going to advance the conversation. So hopefully by the end of the month, we'll be able to take your calls and questions, and you'll have some knowledge or some foundation to base your questions upon. And if you did miss my introduction, my guest is Dr. Mary Hedrick. She is board certified in internal medicine, who has practiced in clinics and emergency rooms in East Tennessee for over 30 years. And as you heard her say, this is an issue that she has been involved with for almost that length of time.
Yes,
is that right?
30 years.
So tonight we're talking about the Patient Protection Affordable Care Act, where in March 2010, President Obama signed comprehensive health reform into law. So just to catch you up, if you're just tuning in, that's what we're talking about. So thank you for allowing me to interrupt you and reintroduce you to our audience.
Great.
So where would you like to go from here?
Well, I would encourage anyone in the audience who thinks they have health insurance that is too expensive, other than Medicare, or anyone in the audience who does not have health insurance, to get a pencil and paper and write down a few things. And so one of the things that I'd like them to write down is the web address for this display you see behind us. This is the federal display where you can get more information. And you can find that at www, and then the period, the dot, healthcare.gov. And you see that, let's see, right up there in the corner, healthcare.gov. That website is where you can learn a lot more. And you can also start the enrollment process once we get this bottleneck of eager folks cleared out and find that folks can actually pass through this website. But it has lots of information. And if you don't have internet, I encourage you to go to your public library. We should, by the middle or end of the month, have reference notebooks there with the material printed out. And also the 800 number is 1-800-318-2596. Did I read that right?
You did, 1-800-318-2596. Also, let me add this disclaimer. Neither community television nor I, as the host of this show, are advocating for this. But it is law now. And so since it is law, and since it is such a big deal, I thought it would be responsible on my part to get someone in here to explain it. So I'm not advocating, neither is community television. But Dr. Hedrick is my guest, and she's a strong advocate for it. But I want to make sure you knew that we at community television, nor I as the host of this program, are advocating this. I thought it would be the responsible thing to do to get someone on here and talk about it.
Great. Well, we spoke about 1 in 7 people are uninsured, and it is that population that will have the biggest change come January 1 in being able to shop for health insurance. But it turns out that making it affordable is going to be difficult. Are you familiar with the term the federal poverty line?
Yes.
Okay. There's a real easy way for folks to figure out where they stand with respect to the federal poverty line, and it is so important to understand that if you want to know where you are in this Affordable Care Act and marketplace and maybe getting subsidies or premium tax credits. So before we even explain those, I'd like to tell people two numbers. $11,490, 11490. That is the poverty line for an individual who lives alone, a household of one, and if they make less than that, they are below the poverty line and we consider them poor. If they make more than that, then they may be low income, but we don't consider them poor. So 11,490 is the poverty line for a household of one person. However, if there are two people, you add $4,020 and you get $15,510, which is the poverty line for a household of two. And I told you that you added $4,020. Basically, for everyone beyond that first person, you add $4,020 so that you get to, with a family of 4, having added $4,020 3 times to $11,490, which gives you $23,550. That is the poverty line, the FPL, Federal Poverty Line, for 2014 for a family of 4.
Now, why is that important?
It is important because if you have a family income from 100 or 1 times the federal poverty level all the way up to 4 times the federal poverty level, you may be eligible for help paying for your premiums and for your out-of-pocket costs.
Okay, and so help paying means what?
You can get help paying for your health insurance in 2 ways. If you're from 100% to 400% of the poverty line, you may be eligible for premium tax credits. That means you've paid taxes in, your payroll tax, your income tax, your withholding, and you can divert part of that as a tax credit to help pay for some of your insurance premium. And it won't apply to everyone in that income range, but it will for many. We think about 79% of folks who enroll in the marketplace will be eligible for some sort of premium tax credit.
Ah, please, may I?
Please.
Okay, because this is getting down to where I wanted people to understand. This does not mean that the government is going to, when you say help, they're not going to give you money.
No, they're going to let you spend some of your own differently.
The help comes in form of tax credit.
Yes.
Because this is not free.
Right.
Okay, all right. I want to dwell on that for a minute, if you would, please.
Yeah.
Okay.
Yeah, and that's a thing that folks, we call it a subsidy, but it really is a premium tax credit for that portion. So those folks from 100% of poverty to 400%, and the way you figure 400%, that just means 4 times. So I told you that the poverty line for a household of 1 was $11,490. So from there all the way up to 4 times that, and that's about $45,000, you might be eligible for some help with premium tax credits.
Mm-hmm.
Now,